Much for joining us, and welcome to everyone today for a great discussion ahead of us. We're webcasting this on YouTube, Twitter and Facebook. Please tweet or post comments using @CenterProPolicy with the hashtag #WhatWomenWant. Those of you joining us on Zoom can ask questions via the Q&A function, and I'm keen to include as many as we possibly can as we go through today's really exciting event. Today's event forms part of the CPP's year-long Women in the Labour Market programme. It has focused on the social and economic benefits of greater gender equality in the workplace and the policies required to get there. My colleague Dean will provide some insights from the programme so far, and we plan to publish our final report in the series in the next week or so. So please keep an eye out for that. And if you haven't already, do subscribe to our newsletter to receive the report and other great CPP insights. Today's discussion focuses on the policy changes needed to reduce the care penalty, whereby those who look after children or adults are penalised in the labour market, whether that's through unemployment, underemployment, or leaving the workforce altogether. With us today, we have a brilliant cast list. Stella Creasy, MP for Walthamstow, Mary-Ann Stevenson of the Women's Budget Group, Emma Stewart from Timewise, and our very own Dean Hoshlaff too. They'll all be given five or so minutes for opening remarks, and there'll be plenty of time for Q&A afterwards. But first, I'd like to hand over to Dean to share some insights from the work programme so far.
Thanks, Ben. I'm going to try and keep this very short and sweet because I know we have some fantastic guests and we're all eager to hear from them, get some questions going. But I really just want to take this opportunity to give a brief overview of the Centre for Progressive Policy's work in this area and our labour market, our Women in the Labour Market series as a whole. When we started this programme, we really had the idea of trying to make the economic case for tackling the gender inequalities, which unfortunately persist in our labour market today. Now, we have certainly made advances. We know that participation among women in the labour market was reaching record highs before the pandemic, and we hope as we see the labour market recovery continue that these records continue to be met. But unfortunately, we have seen the manifestation of severe gender inequalities, which harm the economic well-being of women, their families, their communities, and the wider economy. And we see this with, for example, just things like the gender pay gap, which continues to persist. And we also see this with the concentration of lots of women in low-paid, insecure, part-time occupations. I mean, this is something we need to tackle because, as I mentioned, it really does hinder the economic well-being of millions of women across the UK, and it holds back our economy. One of the issues that we continue to see, and this has become a focal point of the programme, has been the distribution and division of unpaid labour, and very specifically unpaid care, and how that seeps through into the huge gender market inequalities which we continue to witness. And as a result of the CPP programme of work and our research, we've identified 3 ambitions that the UK should set itself to achieve in order to help improve the gender labour market outcomes for women in the labour market and tackle gender inequalities. And those are, firstly, expanding access to affordable formal care, improving the availability of good quality, flexible working conditions, and finally, incentivizing and encouraging a fairer distribution of unpaid care within the home and across society. Now, our first report focused very heavily on the childcare sector, and we did some bespoke survey polling for this, and we found that there was that the inadequacies in the childcare sector were having a huge implication for women in the labour market. We found that 3.7 million women with children had struggled to access childcare, and 1.7 million women said that they would like to work more hours, but they can't because they did not have access to childcare. And that just goes to show exactly what this program is all about. It's all about choice. We want to make sure that women have the freedom to participate in the labour market on their own terms. And that 1.7 million women who want to work more hours, that has a huge economic impact. We estimated that the potential earnings gains could be almost £11 billion per annum for women if we manage to tackle their inadequacies in our childcare system. And unfortunately, we do have a system at present. We do have subsidized care for some children, but these are underfunded. And the underfunding of care, both childcare and social care, reflects structural gender inequalities in our perception of care within the economy and how we value it. That does need to change. But we do need to start by making sure that when we invest in childcare, we at least provide childcare providers with the money they need to meet their statutory obligations. And then we also do need to expand the entitlement to subsidized and supported care so that more children and more working women and more mothers in general can access decent, affordable childcare. And unfortunately, I wish we have not looked at social care specifically in this project, but I'm afraid to say that the social care system faces very much similar, if not greater, challenges. And again, it's about making sure that access to care is improved. However, formal care alone is not enough. We need to make sure that the world of work can adapt to the needs of those who provide unpaid care. We know that this commitment to we have a world of work that's really built around this 9 to 5, 5 days a week, and that doesn't necessarily align with caring needs, and that can have a huge implication for women who provide unpaid care. So what we all want to see is employers to take a step forward to make sure that the employment opportunities that they offer can provide a level of flexibility that meet the needs of those who provide unpaid care. And I know that some forms of flexibility we have at the moment, especially around 0 hours contracts, they have come under scrutiny. They have been criticized for exploitative practices. And this is not what we want. When we talk about flexibility, we need to make sure it's working on behalf of the worker and that there's some mutually beneficial gains for both employers and the workers. And this needs to be realized. I mean, we will have an upcoming report which will explore our policy recommendations in more detail, but I think something that we can definitely want to support, and we know that there are growing coals. I know that Emma will talk about this a bit more, but the right to request flexible working on day one is something that we need to have, because flexible working is a right that we would hope all workers should be entitled to, and we need to make it work for everyone. And we think there are huge gains for those who provide unpaid care if we can get this right. The final challenge, incentivizing and encouraging a fairer distribution of unpaid care within the home. This is a huge challenge. It is almost contingent on those first two elements I've spoken about. But critically, this requires cultural and economic incentive shifts across our society. I won't go into too much detail because it's not something we focus too much on, but one area that I just wanted to raise potentially for discussion is shared parental leave, for example, is an area where we don't have very good incentives at the moment. You have a system where the statutory payment is very low, and this creates huge opportunity costs that families need to consider when a child is born. And if you have a situation for couples where there is a man and a woman, if the man was to earn more, that family would face a greater opportunity cost due to the very low rates of statutory pay. So even from the birth of the first child, we have huge amounts of cultural and economic incentives, which really, which entrench that division of unpaid labor, which disproportionately puts it on the shoulders of women. And this follows them across their working lives. And it's quite frankly unacceptable today that we continue to do this and we are not taking efforts to distribute unpaid labor more effectively. So those are the three ambitions that we set out and the themes that have emerged. We're lucky to be joined some of the most prominent voices in this space who have campaigned and talked about this issue for a long time. And I'm going to pass back to Ben to introduce our next guest.
Thanks very much, Dean, for that excellent overview of the work programme so far. As Dean mentioned, we've got some great guests with us today, and I'm really pleased that Stella Creasy MP is joining us. Stella, how do we, I mean, we've known about many of these issues for a very long time. How can we make change? How can we progress on some of these points that have been raised so far?
Thanks for inviting me to be part of this. I feel the risk always with politicians is that they say what everybody else is going to say, but they don't say it in half as eloquently or educated fashion. I'm very mindful with someone like Marianne on the platform in particular and the work that the Women's Budget Group have been doing, which is amazing work to highlight and showcase the economic case for change, that I will fall into that trap. Let me offer a couple of reflections and then some suggestions about where we go forward. Because I think first and foremost on this, one of the challenges is that it's been seen as a problem for women. It's not, it's a problem for carers, and it's particularly a problem for parents. But often, just like violence for women, because we see it as a problem for women, we ask women to fix it. So we ask women to find ways of working with a system that doesn't work for families, rather than asking ourselves how we make the workplace work for families, the idea of work-life balance. Secondly, as a result of that, it's an incredibly middle-class system. So those of us who use childcare, you don't get the subsidy for childcare until your child is at least 2, if not 3, by which point, if you are going to exit the workplace, you probably already have, because you can't make it work. And I always find it mystifying. I've often asked ministers in meetings quite what I'm supposed to. I've got 2 children, one of them is just over 2 and the other one isn't. What I'm supposed to do with the other one, because I don't know what they think happens before a child turns 2 to make it possible to care for them. And then finally, I think it's about the legislative as well as the regulatory interventions that we can make. I'm completely sold on that. I think it should be flexible in the job advert, because I think you don't start with flexible design once you've recruited somebody. You say you want to be flexible in what you do, but frankly, we need to go much further and much faster, because that's what our economic competitors are doing. And what the pandemic showed us is that there is not a commitment to this as an economic measure. Because the first thing that happened during the pandemic was things like gender pay gap reporting, what little that we do, were cancelled. And it was the only business signal that was cancelled by the government. And the message that sends about the importance of these issues is very, very telling. But what we have seen over the pandemic is that these problems have gotten worse. And in fact, we've seen a lot of women exiting the labour market, particularly mums, partly because our childcare industry has collapsed. Of course, our childcare industry wasn't financially viable before the pandemic, but the pressures of the pandemic have exacerbated those problems, particularly in communities like mine. I have the 10th highest level of child poverty in the country, where you need middle-class parents to be paying for it to make it possible to work. And of course, they were the people who've then been working from home because they can work from home. So it's a perfect storm of problems, which our economic competitors have completely challenged from the get-go. So we know in other countries, not just that they have quotas to get women on boards, but they also have interventionist measures around the gender pay gap, because they recognise, had we spent the last 12 years arguing about how to close the gender pay gap rather than arguing about implementing austerity, our economy might have been in a much better position to cope with the shock, indeed, of Brexit and of the pandemic. But they also recognise that you are losing talent and productivity from our economy. And I don't think it's accidental that we have one of the lowest levels of productivity in the G7, and some of our economic competitors are now moving to a 4-day week, even post the pandemic. So for me, this is very much about how we frame this debate, and then actually saying it's not just about, well, what do employers do? It is indeed about what governments do. We can't keep waiting and asking nicely for things like the gender pay gap or for women on boards to be seen as something as a priority when our economic competitors are doing it. We wouldn't do that with other infrastructure investments, and yet we somehow always do that when it comes to women. And we can't keep saying this is only 51% of the population's challenge to deal with, when actually, I did biology and I'm pretty clear that there are at least 2 people involved in making a baby somewhere along the way. There are a lot of dads out there who hold the key to some of this. And they hold the key partly because they are the ones in employment whose careers do progress. So they are often the people doing the hiring. And if I had a pound for every time I've been offered to go to a seminar and help talk to women about how they should be more confident about applying for jobs, especially if they've just had babies, rather than talking to men about their expectations and preconceptions about employing women who've had babies, that would be something. But it's also about that cold, hard logic about why on earth you invest in infrastructure. We have spent millions of pounds in this country over the last year during the pandemic on tackling potholes. We gave parents a pat on the back for homeschooling. And yet, as I say, I'm very mindful with Marianne on the platform above all. She has done incredible work highlighting how universal childcare pays for itself. I also think when we're talking about shared parental leave, and we talk about incentives, I think the incentive first and foremost should be to be a good dad. And lots of dads do want to be good dads and spend time with their kids. There's lots of strong evidence about the impact on a child's early development for dads to be able to be part of it. That workplaces don't support that tells us something about why government should step in and lead on this. And leading isn't the Chancellor showing off that he's taken his child to a parenting class, because as any mother of a newborn child knows, the other 23 hours of the day do also need covering. It is about a fundamental reform of the expectations we have of employers, built on the economic case for investing not just in childcare, but productivity. And productivity is all that talent that is going to waste in our economy right now because it's shut out, because family-friendly working doesn't exist. And this place, above all, proves that. I'll stop there because I think we should all hear from Marianne, who's got the answer.
Thank you so much, Stella. Brilliant segue into Marianne.
I love sharing a platform with Stella. She's just so brilliant and always makes me feel built up and then slightly anxious about being inadequate. I really welcome this report because I think it's all too often we kind of think about women in the labour market in the way we think about the formal economy more generally as something entirely separate from the care economy. You know, unpaid care work is seen as sort of private or domestic. And then you've got the real economy, the goods bought and sold in the marketplace, paid employment, GDP, and so on, which are seen as entirely separate. And when those two come together, you can see the shock. I mean, you can see the shock when Stella brought her baby into the Commons chamber, that these were kind of two worlds that people didn't think should collide. But I think COVID exposed really clearly just how wrong that is. I mean, many of us have known this for a long time. But when schools and nurseries closed, employers saw what parents had already known, that without childcare, paid work can be impossible. And the government, when they made the decision to keep nurseries and schools open for the parents of key workers, were making an implicit acknowledgement that childcare is fundamental to keeping the economy and wider society functioning. And it is a particular issue for women. I mean, I agree with Stella, it shouldn't be. But it is, because we know that women do the vast majority of unpaid care. So in the first year of the pandemic, the Institute for Fiscal Studies did some research looking at heterosexual couple parents and how they split paid and unpaid work in the first lockdown. And what they found was that although the unpaid work done by men did increase, women still did more. And this happened even when the woman was the higher earner. In fact, the only working situation where mothers and fathers did roughly equal amounts of care were where the woman was still working outside the home. So she was a key worker, for example, and the man was not doing any paid work at all. Either he was furloughed or he was out of work. And in those situations, care was shared roughly equally. But in all other situations, women did more. And that's part of a wider pattern. Pre-COVID, women did 60% more unpaid work than men, mainly care work. And this clearly leaves less time for paid work, which is why women earn less, own less, and are more likely to be poor. And we can see the impact of that over a lifetime. I was talking this morning to another group, and we were talking about private pension wealth. And, you know, private pension wealth is a kind of indicator of people's economic situation over a lifetime. So if you look at 65 to 74-year-olds, among men, median private pension wealth is £182,000. Among women, it's £25,000. Women aged 65 to 74 have 13% of men's private pension wealth. The gap's slightly smaller in the population as a whole, but if you look at women as a whole and men as a whole, women only have 25% of the median private pension wealth of men. And I'm talking about pensions because that really highlights what the impact of women's lower earnings means over a lifetime. But the gap starts way before women retire. I mean, as you said in the introduction, women are more likely to be known as what's known as economically inactive, neither in work nor looking for work, although I think that's, you know, deeply offensive to people who are actually fundamentally contributing to the economy. But there you go. They're more likely to work part-time. They travel shorter distances for work. Women's average commuting distance is shorter because of caring responsibilities, which reduces the number of jobs available. And because employers may think that women may be less committed to their paid work, they're less likely to get promoted and are underrepresented in senior roles. So what should we do about it? Our former chair at the Women's Budget Group, Professor Diane Elson, talks about the need to recognise, reduce and redistribute unpaid care. And I think that's a really good way of thinking about it. So recognise means acknowledging that care work is work. It has to be done by someone and it has an impact on women's economic situation. And that means ensuring flexible working policies so that people can combine paid work and care. And I absolutely agree with the need not just for day one flexibility, but for flexibility in job advertisements. And when we do that at the Women's Budget Group, we start by saying, all work can be done flexibly. Let's work out how best you can do this. Because we all need care at some points in our lives. And most of us will have to care for somebody else at some point, whether it's a child or a parent, a partner or a friend or neighbour. Giving and receiving care are fundamental part of what it means to be human, and they can't be separated from the rest of the economy. So on to reduce. Reduce means increasing investment in childcare and social care services. And again, I very much agree with Stella. We need to recognise that these services are social infrastructure. They are as important to the economy as roads and rail. We all have an interest in them working well, just as we all have an interest in having a healthy or well-educated society. If I need to see my GP, I rely on her having access to childcare so that she can get to work. This is not just an issue for parents, it's an issue for all of us. At the Women's Budget Group, we've made proposals for a universal care service, and I'll stick a link in the chat in a minute, calculating the cost. And redistribute means men doing more. And this is probably the hardest bit. But we can see from other countries where care work is distributed slightly less unevenly, some of the things that make a difference. And I think one of the key ones is maternity, paternity, and parental leave policy. Most couples become parents with the intention of sharing care and paid work more evenly. Most fathers want to be more involved in their children's lives than maybe their own fathers were in their lives. But somehow that doesn't happen. And it's not surprising, really, when mothers have a year's maternity leave and fathers only have 2 weeks paternity leave. This automatically frames the mother as a primary parent. So the person who's expected to take time off if the child is sick, the person who has to decide whether to return to work or reduce hours, the person who, when there's a global pandemic, is expected to manage homeschooling and childcare around their paid work. And even though we have a system of shared parental leave, it clearly isn't working. For a start, fathers are only entitled to shared leave if the mother is entitled. So if the mother isn't entitled to maternity leave, the father can't share it. The rate of pay is too low. And as a result, take-up is low. We need to ensure that fathers are encouraged to take a significant period of leave. And if we look at some of the Scandinavian countries, what that means, this means a dedicated period of leave for fathers and second parents, paid at a level which means families can afford to take it, and on a use it or lose it basis. And that helps establish care for children as the responsibility of both parents. Because unpaid care is at the heart of women's economic inequality. And we can't improve the situation of women in paid work until we recognise, reduce and redistribute it. Thank you.
Thank you so much for those really important points on all of the fronts that you're talking about there. And we hopefully will come back to many of those issues in a bit more detail later on. I'd like to bring in Emma at this point from TimeWise, who's been doing some brilliant work around flexibility and how we can try and encourage more employers to offer flexibility. Emma, over to you, please.
Thanks, Ben. I'm delighted to be here, and congratulations on the report. I think it's some really interesting recommendations and findings, and it's very welcome. So just very briefly by way of introduction, TimeWise is a social business, and we're driven by a mission to enable everyone to get the flexibility they need in work without compromising their careers, women and men. And we work with some of the UK's biggest businesses, supporting them to get better at flexible work. So we also do quite a lot of work with the government. I sit on the government's flexible working task force at the moment as well. So I wanted to give, I guess, reflections on sort of three things I think that we can do if we want to ensure that we have a good flexible labour market that works for everybody. Just to say, I think the pandemic has created a really significant opportunity to rethink how we work. Many of us have had to do so, enforced over the last couple of years. It's not all been good, but there's been some huge learnings. I think the risk with the pandemic is that we've not all had the same experience, and we've not all had the same access to good flexible work. But we have a real opportunity to try and turn it down in some of those areas. So it is a huge structural barrier for women to be able to balance work and care. And there are things that government can do, and there are things that businesses can do and are doing. So I just want to call out three things. The first, clearly, as you'd expect us to say, we would absolutely endorse and agree with everything that everyone said about flexibility from day one should be a legal right. We run an index every year that tracks the state of job vacancies. Still only a third of job vacancies actually reference anything in the job ads. So it absolutely should be not just a right for people to be able to ask for flexibility, but we think more a duty for employers to consider and say so, because a lot of the evidence shows that you won't even apply to an organisation if you don't think they're going to have the conversation with you at the point of interview about flexibility. So we do need the employment bill, and we need day one rights, and we need employers to consider. But we also need to up the ante on the conversation with businesses. We are in an absolute talent crisis right now. All the firms that we work with are struggling to attract skills and talent and diverse talent. And we need to do more as part of conversations around ESG, as part of governance conversations, as part of ED&I conversations with businesses day in, day out, as part of gender pay gap conversations, to talk about the benefits of advertising flex as a way to attract as well as retain talent. The second thing is we need to make sure that flexibility is fair for all workers. And I think what we are seeing is a risk that we've got a bit of a two-tier labour market emerging. We've always had an issue, which you've highlighted in your report, around this challenge of two-way flexibility, as in, is it flexible for the employer, but is it also flexible for the worker? And fundamentally, what does that mean? That means if you are working in a flexible job, you should have some autonomy, some control, and some input into how much, when, and where you work. It should not just all be on your employer to dictate those terms. But I think what we've seen as a result of the pandemic is a challenge. On top of that, inequality effectively within flexible working around a kind of flex haves, who are those of us who have the joy of working from home and working remotely, and the have-nots, who have been roughly half the population who are key workers, who are predominantly women, who are working in frontline roles in the care economy, in the NHS, in schools, in other forums. So we need to make sure that we're able to give them some element of flexibility in their work. And that means thinking about flexibility from a time-based perspective, not just a location-based perspective. We also need to think about how we can create better quality, flexible and part-time specifically jobs for women, because I hear your feedback that there are 1.5 million women who would like to work more, but there's significantly a huge proportion of women and men who want to work less. And we need to make sure that they don't have to compromise pay and security in order to do that. So we need fair and flexible work for all. What does that mean? Again, that means thinking about the employment bill and thinking about the elements within that around workers' rights and advance notice on shifts and schedules, etc. But it also means, and we've seen this in our work day in, day out, investment in management capabilities to work out how to design jobs differently, how to do it in these complex sectors on the front line. And again, mirror the comments that Stella made around infrastructure. We invest millions in R&D and technology in this country. We don't invest in job design and human capital, and we need to do that. So, in terms of what can the government do, the government can think about putting some pump prime funding through Innovate UK, through other means, into giving employers who don't know how to do this stuff because it is complex and who are working in very challenging industries the chance to test and try and support different ways of enabling flexibility for our nurses, for our care workers, for our childcare workers. It is possible. We've got some great example of what works, but there's very little focus on this from a government perspective. It's about how we think about the structural challenges to enabling people to get into work and get on and work, not just the skills-based challenges. And then my third point would be, we again mirror everybody's comments, we need a wider conversation about flexibility that is gender neutral, and it's also reason neutral. We still have a culture where many businesses will want to know why someone needs to work flexibly. Actually, the commercial argument is you get the best out of people if you give them more autonomy and control, all the evidence shows that increases job satisfaction, which increases engagement, which increases productivity. So we need to have a wider conversation, and we need to involve men in that conversation, and we need to think about how we take that conversation into different sectors where men and women operate. A great example is construction, where we actually have a lack of flexibility for many men who are leaving because their ill health and their relationships with their partners are really constrained because of the amount of over-hours they work. We're not going to attract more women into that sector until we deal with some of the issues that men face when it comes to how they manage work and life as well. So I think, we've got a huge opportunity, but a lot more that we need to do and harness with the learnings that have come out of the pandemic. And my point would be, let's make flexibility fair for everybody, obviously women included.
Brilliant. Thank you very much, Emma, and for all of your excellent contributions. We're going to have a bit of a Q&A now, and a discussion about some of the points that have already been raised and any other questions people might have. But a couple from me first, if that's okay. I mean, the point around social infrastructure is a really important one, and actually that's not just this area, that's a whole host of other areas where human capital and social investment are really, really important things. And certainly for us as an organisation, we've been trying to bang the drum for social infrastructure as a way both to help support Level Up, but also support our recovery post the pandemic. But still, those arguments feel like they're falling on deaf ears within the Treasury and within government. It's still all about physical, and there was still some of that within the recent Levelling Up white paper. So how can we devise arguments that are going to convince those who could spend additional money on some of these areas which we think are so important and we know are important? How can we do that and try and because a lot of these things we already know, but how can we cast this in a different light to try and convince the power brokers at this current time? Does anyone want to take that first?
I've got some thoughts. I'm sure Stella's got loads of thoughts. I think there's two things. I think first of all we have to show the return on that investment. So that's one of the things that we've done at the Women's Budget Group, where we've looked at how many jobs would be created for investing the same proportion of GDP in care and construction, and showed that you create 2.7 times as many jobs if you invested money in care as the same amount of money in construction. But I think that actually some of the resistance is it's not to do with a kind of logical thinking about, where you can create the most jobs. It's about a sense of what counts as real jobs and what doesn't. And also, I think the idea that, it's quite a lot of male ministers that like posing in hard hats and high-vis jackets. There's something quite attractive about that idea of, we're going to invest in building things and making things. So I think the second thing we need to do is we need to bring together alliances of people and organisations who benefit from this sort of social infrastructure investment. And I think employers have got a real role to play here. I think if employer organisations were saying to the government loudly and clearly and repeatedly and publicly, the failure to invest in childcare is causing us real problems. You want to know what we need as businesses. Maybe spend less time doing red tape challenges and more time doing investment in childcare so that our employees can get to work, that we can recruit and retain staff and so on. And I think that would be something that would make a difference.
I am more polite than, I'm less polite than Marianne about this, because first and foremost, we need to get these debates out of the Department for Education and into the Treasury. Because at the moment, it becomes the Treasury asking for money for childcare on top of it becomes the Department of Education asking for money for childcare on top of money for higher education, further education, failing to see this as actually it is a different issue, because it is first and foremost about the start of the pipeline. And we all know that investment in early years makes a much bigger difference when it comes to inequality than investment in later years. But actually that debate has then become about the children rather than necessarily the economy and the impact on the economy on this. So first of all, we've got to get this out of the Department for Education into the Treasury. Secondly, we do have to make this an infrastructure issue. Marianne is right that, you know, nobody loves more a high-vis jacket photo shoot, but fundamentally, childcare has to be seen as part of our infrastructure in the same way that roads are, and it's not at the moment. It's seen as an indulgence. And that's why I think you end up with this system, which I mean, I've spent several years now in this place trying to ask people to explain to me where the 2-year-old cap came in. As I say, why do we not pay for children before they're 2? And nobody can explain it to me, because it comes down to an indulgence about people's sense about the time at which people might want to eventually go back to work, rather than a recognition that often the people who are hit hardest by the gender pay gap, the people who are hit hardest by childcare issues, are those people with the least flexibility in their work, often on the lowest incomes, with the least access to affordable childcare. And that's how we end up, say, with this incredibly middle class approach to provision, which means that it's working class people who provide the care for middle class people who then make their work-life balance. I also think we need to point, as I say, to our economic competitors and what they are doing, because if there were other measures that were making a massive impact on productivity, and we see this all the time, we see people talking about Germany, for example, and the impact of investment in green jobs and the idea that investing in sustainable economies, and I think Emma was talking about research and development, is, you know, a clever, safe, you know, invest to gain process. Look at our competitors and where they're investing in childcare in the same logic and the same way of doing it. You know, why are we asking businesses in the same way they report their corporate sustainability, to report their corporate family friendliness? Because actually it's in all our interests to be able to do that. And yet at the start of the pandemic, the only message that government sent was, oh, this gender pay gap malarkey, don't worry about it. And we've not had a commitment since to reinstate it. And I think it is about the messages we send about how important this is, because we recognise the economic costs of doing it. And until you see this as an economic problem, you know, that equality is a cold, hard, logical issue rather than an indulgence of women to give them someone to look after the kids so they can go and have a coffee with their mates on the afternoon, which is the kind of stereotype that you get. I mean, I often find in this place, if I talk about women, it's a bit like I'm talking Klingon, because you've said the word woman and you'll get an answer back from the government, which might be about women entrepreneurs, or it might be about the gender pay gap, and you've asked about childcare. But it's like you said a phrase about something they've not really thought about. It may as well be in Klingon, but they've got an answer which is something to do with women, so that should do, as though we're a lumpen proletariat. The other thing I would say about this is it's very important that we don't see women and mothers indeed as equally in need of the same services. If you've got a child with special educational needs, the challenge is, the pressure on you is much harder. If you are a single parent, the challenge is much harder. And again, until we see this as about the talent that is draining from the workplace, because we can't make things work for the other 50% of people's lives, we will always miss out on those people, and we won't create a system that is capable of being flexible enough to deal with those challenges. So what you might get is a few women going into the workplace and a few men who might get to take some time off and do. And as I say, if I had £1 for every man who used the phrase daddy daycare, I would probably use it to pay my lawyers, because I've been in a lot of trouble with these people because I find it so infuriating. But, you know, so much of our debates on this are framed by kind of temporary measures rather than a long-term commitment to recognising the range of family experiences that people have, how this intersects with social class, how it intersects with regional inequalities, because of course we can recognise that provision of childcare, provision of work that fits the parameters that Marianne is talking about varies by region as well. It will always be another barrier to people, and it will come back to the Department of Education and whether you've got ministers fighting for higher education or early years education. That's just completely the wrong frame for this.
Ben? I thought just a very practical one. I mean, I agree with everything people said, but just on infrastructure, I mean, I think there's something we can do around soft leverage right now, as while we deal with some of the big stuff. So, I mean, I think the regional mayors have got less control probably in budget than they would like, but certainly the ability to leverage through some of the kind of processes that they have in place. And I look at Scotland and the Fair Work initiative there, Fair Work criteria. They've just introduced flexible working from day one as one of the criteria for Fair Work. Anybody being procured by the Scottish Government, anybody who is looking to win business as an employer needs to consider how they can adhere to that criteria. So I think there's leverage we can put in place around infrastructure playing to it in the way it exists now, if we're thinking about building and contracting, etc., etc. But there's lots of other forms of infrastructure. And I just think that's an opportunity that we need to draw on right now, because, some of the businesses who are actually good at some of this stuff have huge supply chains and huge commissioning processes in place that we can tap into right now as well.
Brilliant. Thanks for all your answers on that one. There's a couple of questions that are coming through to us through the chat and Twitter. One, which I'll come to you, Dean, if that's okay, is around the pandemic highlighting the value of care, both social care, healthcare, but also childcare. You think there's a way we can build on? So obviously there are economic things that we can talk about, which is what we've already been focusing on, and some obvious things we can do there. But perhaps there are other forms of argument, also emotive arguments that we could use, especially around the notion of key workers, etc., that we might be able to build on to make the case for the things we're talking about.
Yeah, absolutely. I mean, the slogan is "Build Back Better." For that to mean anything, for that to translate from rhetoric to reality, we do need to start recognizing that some of these services, which really had a light shone on them by the pandemic, are critical to the functioning of our society. And, it's not just about, when we talk about investing in these sectors, we need to recognize that they have immense value to the communities that they serve. And that means we're not going to build back better if we don't have a childcare sector or a social care sector which can actually can meet the needs of the local community. And that's not just about, even if we invested the sort of bare minimum just to get these sectors to a functioning level to meet their existing obligations, which are completely inadequate to deliver the sort of level of professional care that we need in society, we still have these sectors of being they're reliant on heavily underpaid staff. They're reliant on insecure working conditions. And it's no coincidence that these sectors have a significant female labor force. And again, I tried to touch on this earlier, but I think, Marianne, would probably be a better place to talk about this. But the way we value care as a society and the way that we dismiss it and the way we underfund it does stem from the fact that we are just so dismissive of it. And we cannot continue down that path. We cannot continue to think that care is not central. As Stella previously said, this is social infrastructure. It is vital. We cannot run our economy without it. And I know we've talked a lot about the economic arguments, but just fundamentally on just a social level, we need to care. Everyone needs care. And if we're not willing to invest in it, then we are not going to, we are really pushing this onto the individual. And just, as a side point, I do know that there are these arguments which really try and put this on the individual themselves. I know we had that whole comment about care beginning at home. I mean, if some of the people making these comments were ever faced with a situation where they had to give up their careers, their prospects, their livelihoods in order to just completely step back and just deliver care, I don't think they would have the same attitude. This is a collective problem, and it's something that we need to take collective responsibility. And there are many things we can do, but starting with providing resources for our care sectors to deliver some care would be a really, really good first step.
And just as a quick plug for our final report that's coming out, potentially next week, might be the week after, but that will have some survey data in it to try and better understand where the public are in terms of thinking about who should support people who are working and caring more. Is it actually about the individual, or is it about state? Is it about partners? So we're going to try and untangle a bit more of that with the data that's going to come. But the one thing I think is a really important question is around the role of fathers, and we spoke a bit about parental leave earlier on in today's event. And obviously shared parental leave does not seem to be working for many of the reasons that Marianne was mentioning earlier on. Where should we go? Where should we go with the parental leave policies that we currently have? Who are the countries that we should seek to emulate? Obviously the Nordic countries are always put up there, but are they models that we could potentially use and could work in a UK context? Really interested to hearing what you have to say. Perhaps come to Marianne first on that.
Yes, I mean, one of the things to say is that you wouldn't start from here, right, if you were devising a perfect leave policy. And so we can't necessarily just take another model off the shelf and put it into place, because you already have a set of current leave entitlements. And politically, it's very difficult to do something which involves taking away people's leave entitlements. So I think what we need to look at is, first of all, ensuring that leave is paid at a level that means that everybody can afford to take it. And the moment it isn't, and that's true of mothers as well as fathers. And secondly, that there is a significant period. I mean, we're not talking a few weeks, we're talking, 3 months at least of leave, which is dedicated to fathers and second parents. And that is leave that that there's an entitlement in their own right, that it doesn't depend on the mother's entitlement, that there is support for self-employed fathers and second parents in the same way as we have maternity allowance for those women who are self-employed who wouldn't qualify for maternity pay, and that it's paid at a decent level. So, as Stella said, so that families can afford for people to take it. And I think that establishes the principle that care is something that should be shared equally. And then there's arguments, some people would argue that what you want to do is have all leave as individual entitlements and no sharing because you want to have absolute equality. Other people would say, well, actually, parents' situations are different, their circumstances are different. You have to have some provision within which leave can be paid. So you have a period of dedicated leave for mothers, a period of leave for fathers, and a period that is shared. And there's a number of different models out there, and we talk about some in our briefing. And whether you go for a kind of a 4 month model, 4 months for each parent, and then 4 months for either, to be shared between parents, or Maternity Action have got a model which is a period of leave that's about recovery for birth, and then leave for both parents, it's about parenting. And then a shorter period of leave for fathers and second parents, it's about supporting a new mother. And that's about recognising both what the current legal situation is and that there is something specific about pregnancy and childbirth. Parenting can be done by either parent, but pregnancy and childbirth, there is a need to allow mothers to recover physically from that process of giving birth, and that needs to be protected.
Thanks very much, Mary. And Stella, did you want to make any points on this issue?
So, no, I mean, I completely agree with Marianne on this. I think it's also an interesting one because the reason why the economics don't work is the scheme was built on this idea that 2 weeks was all you needed, and really this is just about making sure employers gave you an extra long holiday. If you look at the British Social Attitudes Survey, it shows a 0% of people in favour of dads looking after babies opposed to mums, and yet that doesn't make any sense for the dads involved themselves. And what we really need in this, I mean, obviously that you've got a panel, it's great to have Dean here, but we need men speaking up for the fact that they are missing out on being with their kids, and that they want to see them changing in their workplaces. What I think is also worth acknowledging is the good employers who are starting to do this. So in the private sector, some of the bigger corporates like Aviva are actually bringing in policies to give 6 months paid parental leave that men can take the full 6 months if they want to. And I think that's a really powerful sign that, frankly, the public is ahead of the politicians on this. But as somebody who's been remonstrated repeatedly for having a baby and has no maternity cover and no support for maternity cover amongst my colleagues, we're a long way in Parliament from recognising the reality for most parents, which is that challenging struggle about who's going to pick up the kids and who's going to do what too often falls upon the mums. And that's not throughout the choices of the parents, that's the reality of the working lives that they have. And changing that opens up opportunities for both sides. It opens up opportunities for dads to have a better work-life balance, but it also opens opportunities for mums to progress their careers in a way that means that you haven't got an army of overqualified and under-promoted women sitting in our workforces as you do at the moment.
Absolutely. And Emma, is there anything you wanted to add at this point on this question?
No, I mean, we do work with Aviva and they are really good at this. And I think there are some corporates that are stepping up to the plate. And it's about paying dads to be able to do it. But I think it's also about challenging the stigma of taking time away from work. And, all the sort of anecdotal feedback. And I think a lot of research shows that, one of the reasons that men don't necessarily do this is because they think their careers will be impacted in the same way that women's have been, and they're right to think that. So, we have to kind of break that cycle and show more men talking about this openly. And we've also got to tackle the issue around progression, which, let's face it, the gender pay gap is a gender progression gap. It's about the fact that you don't have the ability to balance work and caring up into senior roles. There's a lot of flexibility and certainly part-time work in lower paid roles at the bottom end of the labour market. So we've got to shift the nature of that flex up, as well as thinking about parental leave, because parental leave is a period in time, but raising children and then looking after elder care are things that we all face in life, and we all need periods of time out from work in order to do that as well.
Brilliant. Thank you very much for that, Emma. And there's some points in the chat as well. Tina's spoken about the long-term impact of childhood experience and needing a culture change in terms of how we think about the economy, and obviously children and women's lives as well, as part of all of that, which is such an important point, and links back to the social infrastructure issues we were talking about at the start, trying to think more long-termist on many of these issues rather than thinking day to day, as seems to be the case at the moment. I'm conscious we've only got a couple of minutes left, so I'm going to wrap up here, but I'm going to put a couple of plugs in for our newsletter again. So please do sign up for that to get our events updates if you haven't already. We have exciting events to come in the spring, so please follow our mailings to know more on that. Thanks to our speakers, our online audience, and those of you who've asked questions. And we will continue working up the final report, which will be published hopefully next week. So keep an eye out for that. But that won't be the end of our work on this front. It's something that we want to continue to pursue. It's of vital importance, of personal importance to me. I care deeply about this issue. I'm a dad of two, and care about trying to do my bit for my children and my family as much as possible. And it's a very personal issue for many others, as well as being a massive issue for the economy and society. So with all of that, I'd just like to say thanks to everyone involved, and hope to see you all soon, and keep safe. Bye for now.
Thank you. Bye-bye.